Hello everyone, and welcome to the World Health Organization and this week's meeting of their executive board. They are meeting all week here in Geneva, and you may remember that this time last year the executive board made the recommendation that this year should be designated as the year of the nurse and midwife. And you can see that on the displays, on the banners that are greeting the country representatives as they arrive for this executive board meeting, very clearly declaring that 2020 is the year of the nurse and the midwife. The executive board is comprised of representatives from 34 of the member states, and their job is to implement the policies of the World Health Organization. They meet twice every year and are really important in terms of seeing implementation of WHO policy and WHO priorities. Because of ICN's special status with WHO, we are able to have a delegation of nurses here. We intervene, that means that we speak to items that are being discussed and debated this week. We will be speaking on agenda items related to non-communicable diseases, to ageing, to primary health care, as well as a range of other events that we're involved in, from cancer to youth engagement and involvement in the work of WHO. So this is a really important week for nursing to ensure that its voice is heard, influencing and impacting on the WHO agenda. But this is also a very significant week for World Health. Many of the delegates and representatives who are arriving here clearly very focused on the coronavirus and how we see that spreading throughout the world at the moment. ICN, the ICN president, has written to the Chinese Nursing Association, a member of ICN, to send our support, our sympathy, our solidarity. We know that the nurses in China are working incredibly hard under difficult circumstances. But we also know that there is an issue about having enough supply of personal protective equipment to keep not just the healthcare staff safe, but to contain the virus and prevent its spread. ICN has issued a statement about this. We have been in contact with WHO officials last week and will continue that this week as well. It's a fast-moving and developing situation, but ensuring that healthcare workers are kept safe, as well as good public health measures to contain, to manage and to prevent the spread of this infection is an issue which is going to be at the forefront of much of the discussions here over the next few days. We will be updating you over the course of this week with all of our activity, what we're saying, who we're talking to. Hope that we'll have an update for you in relation to coronavirus as well. So stay tuned to the website and to the usual channels, and keep on enjoying and celebrating this, our special year, the year of the nurse and the midwife.